What about mental, cognitively? Are you feeling any difference mentally?
Yeah, cognitively for sure. Lots of brain fog. I did have lots of brain fog before. And like I said, the headaches too, I would have a lot of headaches. I've noticed a lot more. I don't get as mad over the little things. I still get angry over some stupid stuff, but who doesn't in the moment? But I notice like less of that, just being on edge. Lots more calmness as I've been on this.
How about has anybody noticed that you're doing this? Family, friends, other chiropractors? Anybody noticed that and thought this is bizarre?
My the other chiropractor I work with, he thinks I'm gonna die. So he's like, "You're gonna get gout and you're gonna die." And I'm like, "All right, now I gotta do it long term just to prove a point." But I talk about it a lot. So anytime you're just eating meat and you don't eat what else is around, everybody asks questions. Or you bring your own meat to an event, everybody asks a question. So it kind of gets annoying, but at the same time, I'm like, I really enjoy talking about it because it's just, it's changed my life. It's seriously, I didn't know I could feel this good. I'm only 27 and you're not really supposed to feel that bad when you're this young, but it's like, I feel like I did when I was 16 years old.
Yeah, it's
maybe even better.
Yeah, it's interesting because you may not even know. You don't even know how good you can feel, and it's just kind of like you kind of accept it's a normal thing that so many people spend their whole lives in this sort of state of, basically suboptimal health. I guess that's the best way to put it.
And it's kind of like a slow fade into that too. Like from birth. We're put on some sort of medication, or at least most people are. That's how it was for me. I was on a medication always, as far like with my asthma and stuff. Luckily, I did not do any topical steroids for my eczema. I had it a little bit when I was younger, but it got more severe as I got older and got stressed out. But did not have any topical steroidal withdrawal. But like you said, you just don't realize, because you kind of come to accept like, oh, well, this is just normal. And that's what's supposed to happen. You're supposed to break down. So I fully intend on doing it for the rest of my life. I really appreciate the diet and the work you do, man. Like you're out there preaching the good word, brother. I appreciate it.
Yeah, I do feel like a preacher sometimes. It's kind of fun. I'm not a particularly religious person, but it does feel like that to some degree. But it's kind of there's such a dearth of information out there, and it's good that more and more physicians. And it seems like, I don't know why, maybe it seems like I've seen a lot of chiropractors, relatively speaking, maybe even more so than MDs that adopt this diet. Why do you think that is?
There's this open mind, I guess, to just try that. It's very logical. Like, I don't know, there's not many. If you're a chiropractor, you're basically swimming upstream. Like it's a very misunderstood profession, and you're also kind of weird usually. But I don't know. I think there's like this open-mindedness and just less dogma to overcome. As far as like, if you run into somebody who's a nutritionist, they're set in their ways. And also like a medical doctor too, they're also very set in their ways, and they're going to think, hey, this is only solvable with medication. Chiropractic comes from the standpoint of, the power that made the body heals the body. So we are innately able to heal ourselves, and that's kind of the basis for chiropractic.
And correct me if I'm wrong, but most chiropractic practitioners are kind of self-employed. They're usually they're not attached. They're not employed by a big chiropractic hospital system or anything like that. So you tend to be very independent of these other facilities. Is that fair to say? That's
correct. I'm an independent contractor with. I'm going to be at the beginning of the new year with the fellow I'm working with. But he's it's very independent outside of. It's not like a physical therapy or anything like that. You're basically, like I said, you're swimming upstream. Mm-hmm. So you're kind of doing your own thing, because there's not really there's no hospital system that really wants to take you in. Even though a lot of times chiropractors they'll be the grand slam opportunity that somebody's looking for. They've gone to hundreds of different places to try and deal with their low back pain or their neck pain or anything like that. And usually we can fix them up within a couple visits. So it's a great, I think the mentality it should be portal of entry, it should be where people start for their musculoskeletal problems. And if it can't be solved there, then we look deeper into either nutrition, or if they're not into that, send them on to a surgical situation.
Yeah.
So I obviously try to avoid the latter of that, but
yeah, I mean, obviously, someone trained as a surgeon, I mean, we took care of a lot of it. And some of it's absolutely appropriate for it. I mean, you get somebody with, broken bone that needs surgery, you got to fix them somehow. Right. I mean, there's
right, exactly.
There is, as far as, you said you discuss with some of your patients nutrition. How do you select those that are going to be doing? How do you get them? What's your success rate, or do you have any? Are you using any props or tools or resources to help to facilitate? Because I know when I was in practice, I didn't have time. I mean, I literally had 5-6 minutes with a patient. It's really, really difficult to get this conversation started and going and actually get anything there. So I was just like, here's a handout, please take a look at this. And it's not a really effective way to do it, but it's the best you have. And so how do you do that? How do you deal with that?
Right. So I spend probably, I would say maybe 15 minutes with each of my patients. If it's somebody who just wants to get adjusted and get out of there, you kind of have to meet the patient where they're at a lot of times in chiropractic. So if they're there for the emotional connection, or they want to have a conversation with you, you spend a little more time with them. But other times, you can get somebody in and out within 5 minutes just because they want to get adjusted and get on with their day. But I would say if they talk to me about like any autoimmune condition, that is always a great way to kind of start that conversation, because I'll make time for them too. If that's the case, like, even if I have a waiting room full of people, because that's very important. And I'll go, like you said, I have a little flyer that you give to them. So I've printed out my own protocol and what you can do. I don't charge them anything for that, or, I don't do like consultations, but usually it's throughout the visit that I'll explain this to them and kind of plant that seed and get them started on that conversation. But it's so hard. I feel like the hardest conversation to convince people of is that their pain levels are directly related to what they're ingesting. Like, okay, yeah, your knee hurts. How the heck does that translate to what I'm eating? So, I try to explain that as easy as possible. But it can be a little bit a detail-oriented explanation. So again, like you said, it just takes a little bit of time, but I try to make time for those situations because I genuinely want to see people get better. I don't want to see them in my office, for obviously, for every week for the rest of their life, just because they're hurting so bad. So I genuinely want to see people get better.